Hi guys, hi everyone, welcome back to my channel. Yes, today I'll be talking about something that is very important in the life of every new mom. Even if you're a new mom, you're an old mom, as long as you're still in that period of conception, this particular topic is for you. So please, if you're yet to subscribe to my channel, don't fail to click on the red subscribe button on your screen and also on the notification bell so that whenever I upload anything new, you'll be the first to be notified. Yes, so today I'll be talking about how to breastfeed a newborn baby. Most of us, we do breastfeeding, but we don't know how to breastfeed. We don't even know the advantages of breastfeeding. I decided to treat this topic because so many new moms around me, my friends, my siblings, people that know me and know how I train and how I raise my children are always coming to me and say, "Auntie, please, can you please tell me this, tell me that?" So I just said, okay, since people are always wanting to know things like this, let me just put it on a video for everybody to benefit from it. So please sit tight if you want to know more about how to breastfeed your baby, the advantages, and why you should breastfeed your baby. Please keep watching. So now I'm going to tell you my own experience, because when I gave birth, I had a very bitter experience. When I mean bitter experience, I don't even wish my enemy to have that kind of experience. I had what we call breast crack. Even my enemy, I don't wish my enemy to experience breast crack. I had what we call, when I mean breast crack, serious one. In fact, it was as if my nipple wanted to fall off. It was very severe that anytime the baby cries, my mind will just do I'll be like, God, I'll just start crying. And when the baby is sucking, my husband will come to the back and hold me down on my shoulder, because the pains was it was in another level. So I decided to come and share my own experience and maybe tell us why I had that crack, and tell new moms how to prevent that crack, because it's not even something that I even wish my enemy to have. When I gave birth, I didn't really know that when you're pregnant, you normally clean your breast, your nipple, and that black area is what we call the areola. You clean that place. Just get maybe a cup of warm water, maybe a little salt, then face towel. Then every morning, every day, you just use it to clean the mouth. And if you do it consistently, you find out that you will be seeing all this small black stuff. It's kind of scraping off the upper layer of that areola, because all those places are part of the breast, and breast milk also comes out from it. So I didn't know, I wasn't informed, or maybe I was, but I was kind of lazy to do it. So but maybe 1 week to delivery, I now started doing it, started cleaning, and when I gave birth, I started breastfeeding. After breastfeeding my baby, I'll find out that there's this black dots, all those black stuffs that I'm supposed to clean off. They will now stay around the mouth of the baby. He's now sucking everything in, So after 1 week of delivery, I was encountering serious pains on my nipple. I think my left nipple, serious pains, like play. The breast started cracking, as in serious. When I mean crack, like it was as if they used knife to cut the nipple widely open. I said, God, what is this? I really thank God for my doctor then. She was so helpful. She told me that I didn't position the baby's breast initially very well. So one thing that could cause breast crack is when you don't position the baby's mouth very well to the nipple. Most times when we breastfeed, we just breastfeed and put just the nipple. You need to put both the areola, both the nipple, cover the baby's mouth with as much as you can put into his mouth. Don't just put the nipple. When he stresses that nipple, it begins to crack. So that was what she actually told me. So she placed me on an antibiotics, and after a few weeks of pains, I started healing. I started healing, and I started getting better. I started enjoying the procedure, because then I wanted to do exclusive. I know what it means to do exclusive, just strictly breast milk. So after that period, I was still able to embark on my exclusive, because I've already made up my mind that I was going to breastfeed all my children exclusively. So now I'm going to be telling us things that we should do to prevent that breast crack. One, once you're pregnant, you're already getting to your third trimester, start cleaning off immediately. Do it a daily routine. You can use Vaseline, you can use the water therapy with the face towel, you can use Vaseline, any which one. Always make sure that your hands are on your breasts every morning after bathing. I don't mean when you're showering or you now use sponge. No. Once you are through with bathing, get a cup, warm water, salt, or get Vaseline, rub and scrub. You see dirt coming out. Then when you're done with that, you massage your nipple so that your nipple will also be coming out well. So 2, position your baby very well. Most times when we're breastfeeding, you see most mothers, they stay like this, like you are going to the baby. No, it's not supposed to be like that. It's the baby that is supposed to come to you. You relax yourself, sit comfortably well, no shaking, just relax. Even if the baby is small, you can get a pillow. You don't even need to buy breastfeeding pillow. You can get your bed pillow, put it on top of your lap, then place your baby on top to push up the baby. You relax, feel comfortable, and do what? Breastfeed your baby. Secondly, avoid pacifier. Yes, I know most people will say, no, I can't do without it. Pacifier is not good for a newborn baby, but most mothers normally use it. At times when you use pacifier, you won't even know when your baby have not eaten. My mom, when she came for mugo, she said, no, this baby will not use this thing. I've seen someone that the child died because of what? Pacifier. Every time, once the baby just cries, the woman will just take it. I'm busy, I'm washing. After washing, she'll enter cooking. From cooking, she'll go to the market. The baby is still on what? Pacifier. And before you know it, the baby started getting weak. And from there, started having so many complications. So avoiding pacifier is good. But if you feel that you can monitor it, if you feel that you're going to be available to really know when, and maybe have food timetable for your child, maybe have timer to time that, okay, it's time for her to eat, fine. But if you can avoid it, please, it's better you avoid it. And thirdly, breastfeed as often as you can. Breastfeeding is good, is lovely. So now I'm taking you down to the advantages of breastfeeding. When you breastfeed your baby, there's this mother-baby bonding. And when you're breastfeeding, not when you are breastfeeding, you are talking, looking around, looking up and down. When you are breastfeeding, that period is the period when you connect with your baby. Your baby, you should be looking at your baby, playing with your baby, talking to her, telling her so many things. I'm not saying you shouldn't talk. If there's need for you to talk, you just talk and still focus back on your baby, because that period that she's sucking from you, he's sucking from you, there's this chemistry that is going on, there's this connection, there's this bonding, So that period is a period for mother and child alone, please. And 2, breastfeeding is cheap. I normally tell people breastfeeding is cheap. It's cheaper than bottle feeding. The only thing breastfeeding requires from you is make sure you are well fed. Eat very well. When you eat very well, and make sure that you are okay, your breast, even when you eat very well, you feel it. The hormones, you'll be feeling the breast hormones, they'll be reacting. Then when the baby sucks well. Not when you don't feed well, you now come out tomorrow and say, oh, I'm doing exclusive. You say, you can't do exclusive. For you to do exclusive breastfeeding, you need to feed very well. Take a lot of water, take a lot of milk, take a lot of beverages, a lot of fruits, a lot of good food. Like the Igbos will give you like pounded yam and salad, you know, nice food that will help the breast pop up very, very well. So eat good food, and when you eat good food, when you're breastfeeding, you will see the reflection of that breast milk in the life of that baby. You see the skin will become so clear, the baby will become so chubby. Even if the baby is not chubby, when you look at the baby looks healthy. The baby will have this natural weight on its own. And thirdly, when you also when you breastfeed very, very well, or breastfeed exclusively, all these viral infection, respiratory infection, all those sicknesses, your child will not even experience it, because there's this substance that is in breast milk that helps them and protects their immune system, that makes their immune system very, very strong. So when you breastfeed exclusively, you find out that all those nyama sickness, maybe when it's time for Apollo, or when it's time for maybe cough and catarrh, diarrhea and the rest of them, any small thing, so just catch it. Won't be for any mother that is actually breastfeeding well. When I mean exclusive breastfeeding, no water, no milk, nothing, purely exclusive. Yes, I know that it's difficult, but if you bring out your time to do it, you can do it. Then if you feel that you want to introduce bottle feeding, please make sure that you sterilize your bottles. Make sure that your teeth is well sterilized. Make sure that, in fact, if you have to be the one that will handle it personally, please do it personally, because if those bottles are not well sterilized, the child can get infected. That's why they advise breast milk alone. Just you wake up in the morning, if you are yet to shower, you clean your breast. Maybe you went to the market, you're just coming back from the market, you rush and just clean your breast with a towel and breastfeed your baby anywhere you're going to. Yes, I know it's at times it may be a little bit discomforting, because you have to go to anywhere you're going to, you have to carry your baby, but it's just for a while. You go with your baby to anywhere you're going to. But when you're bottle feeding, you can keep your baby at home and someone can take care of her. If she needs to feed, they'll just make the mixture and give to her. But it's just a matter of what? Time. So guys, please, that was actually my own experience on breastfeeding. So when I had my second child, I never had that encounter, because I had to learn from the first one. I had to prepare myself, I had to clean very well, I had to position my baby very well, I had to make sure that my baby was relaxed, I myself, I was relaxed, and everything went well. I gave birth to the second one on exclusive, the third one exclusive, the fourth one exclusive. And if I'm to give birth tomorrow again, I will still breastfeed exclusively. Guys, trust me, exclusive breastfeeding is just the best for your child. Yes, some will say, okay, I'm working, how do I combine exclusive breast? I see people that work and they still breastfeed exclusively. Just buy this breast pump and extract your breast milk, put them in the fridge. When it's time for the baby to feed, they warm it and feed the baby. You can go to wherever you want to go to, come back, and you still meet your baby hale and hearty. So it's just a matter of choice, it's a matter of decision. So please, if you find this video useful, please give us a what? Thumbs up, like our videos, share our videos. If you have any question for me, please put it in the comment section. I'll get back to you through the comment section. See you in my next video. Please stay safe. I love you. Bye.